Good morning, everyone, and thank you for joining this GARnet learning session on AI governance, frameworks, and assurance. My name is Andrew Bodler, and I'm the Principal Data Analyst at MIAA. I'd like to start by briefly introducing what we'll cover today. In this session, we're going to explore how AI governance can be embedded in health systems to ensure that the use of AI is safe, ethical, and effective. We'll discuss key principles, go over practical steps for implementing governance, and look at some real NHS examples of AI in action. Before we dive in, I have a quick question to get a sense of everyone's experience. How many of you are currently involved in AI projects in your organization? If you've raised your hand, great. It's wonderful to see that many of you are already engaging with AI. If not, no worries at all. Even if you're not involved yet, consider this session a head start for when those AI projects come your way. The goal is that by the end of our time today, everyone will feel more prepared to approach AI with strong governance in mind. Now, let's take a look at how we're going to spend the next hour. Here's the agenda for our session. On this slide, you can see an overview of our agenda, along with the time we've allocated for each part of the session. We'll start with why AI governance matters. About 5 minutes on the importance of governance in the context of AI's opportunities and risks. Next, we'll set the NHS context, another 5 minutes, reviewing the specific frameworks and regulations in the NHS that shape how we govern AI. Then, we'll discuss the principles of AI governance, 5 minutes on the core principles like safety, transparency, accountability, and ethics that underpin good governance. After that, aligning with assurance is another 5 minutes, covering how to meet key NHS requirements and make governance a continuous process. The practical steps section is 5 minutes, and time permitting may include an interactive activity. Here we'll go through concrete steps to implement AI governance in an organization, and I'll ask you to participate in a short discussion exercise. We'll then talk about building trust and accountability, 5 minutes, focusing on stakeholder engagement and transparency practices that help people trust AI. We have an NHS case example, 5 minutes, to illustrate governance in action through a real-world pilot project in radiology. We'll examine challenges and lessons learned, another 5 minutes. Common challenges you might face when implementing AI governance, and what we can learn from them. Then a quick summary, about 3 minutes, to recap the key takeaways of everything we've covered. Finally, we've set aside roughly 5 minutes for Q&A, so you can ask any questions or share thoughts at the end. In total, that's just under an hour of content, plus time for discussion. I hope you'll find the examples and the interactive parts useful. Governance can seem like a dry topic, but we've included real examples and a group activity to keep it engaging and relevant. Let's kick things off with our first topic: why AI governance really matters in healthcare in the first place. On this slide, we pose the question, why does AI governance matter? To answer that, let's consider the two sides of AI in healthcare, the huge potential and the significant risks. First, AI is transforming healthcare. Think about diagnostics, predictive analytics, and operational efficiency. AI is already helping doctors detect diseases earlier, predict patient needs, and streamline hospital operations. For example, some hospitals use AI to read radiology scans faster, or to predict which patients might need extra care next week based on their data. These advances can save lives and resources. That's the promise of AI. But with opportunity comes risk. AI systems aren't infallible. Without proper oversight, they can introduce serious problems. Consider the risks. Bias. AI can inadvertently perpetuate biases present in its training data. If the data isn't diverse or representative, the AI's decisions might be unfair or skewed. In a health context, that could mean certain patient groups receive less accurate predictions or care recommendations, simply because the algorithm wasn't trained on enough examples of those groups. Safety concerns. If an AI makes a wrong recommendation, say, missing a tumor on a scan or suggesting an incorrect medication dosage, it directly impacts patient safety. We need assurance that AI tools are at least as safe as current practice. Accountability gaps. If an AI does make a mistake, who is responsible? With traditional clinical decisions, there's a clinician accountable. With AI, it can be unclear. Was it the software developer? The hospital that deployed it? This lack of clear oversight can be dangerous, because it may mean issues aren't addressed promptly, a kind of not my problem syndrome. This is where governance comes in. AI governance ensures that these powerful tools are used safely, ethically, and transparently. In other words, governance puts guardrails on AI. It builds trust. Clinicians and patients need to trust AI outputs, and they will if they know there are checks in place. It demands transparency, so we understand how AI decisions are made and can question them. It enforces ethical use, meaning issues like bias or privacy are actively managed, not discovered by accident later. Without good governance, what happens? We risk patient harm through unsafe or biased AI decisions, and reputational damage to our organizations if an AI causes a scandal or public distrust. Essentially, poor governance can undermine all the good AI might do. You've heard some potential risks. Let me ask, what's the biggest risk you see with AI in health? Is it bias in the algorithms? Safety issues like a misdiagnosis? Data privacy breaches? Or something else? Absolutely. Bias is a huge concern. We have to ensure AI works well for all patient groups. Patient safety, of course. We need to be sure an AI won't, for example, miss an important clinical warning sign. Data privacy. Yes, AI often needs a lot of data, so we must safeguard patient information. These responses highlight exactly why we need governance. All the things you just mentioned, bias, safety, privacy, are precisely what a governance framework addresses. Governance gives us a structured way to manage these risks, so we can confidently take advantage of AI's benefits. Now that we understand the importance of AI governance in general, let's zoom in on the NHS context. What has the NHS put in place to ensure AI is governed properly? We'll look at the key frameworks and guidelines that anyone deploying AI in an NHS setting needs to follow. This slide is titled NHS Context. It lists 4 major frameworks and guidance documents that shape AI governance in the NHS. The NHS AI Assurance Framework, Data Security and Protection Toolkit, MHRA Guidance for AI as a medical device, ICO Guidance on Data Protection. In the NHS, governance isn't optional. It's built into these assurance frameworks and requirements. Let's briefly go through each. NHS AI Assurance Framework. This is a relatively new framework, specifically designed for AI. The NHS AI Lab introduced it to ensure that any AI system used in healthcare meets certain safety, effectiveness, and ethics standards before it's deployed. Think of it as an official NHS stamp of approval process for AI. If you're bringing in an AI tool, you'd use this framework to guide testing and evaluation. For instance, checking clinical validity, bias, and so on. It ensures questions like, has the AI been rigorously tested on relevant patient data? Is there a clear explanation of how it works? By following the assurance framework, you're aligning with best practices, so that by the time an AI tool is in use, both staff and patients can trust it has been properly vetted. Data Security and Protection Toolkit, DSP Toolkit. This is not AI specific. It's something all NHS organizations use annually to demonstrate they are handling patient data securely and in compliance with data protection law, like UK GDPR. For AI projects, the DSP Toolkit is very relevant, because AI often involves large datasets or sensitive patient information. If you deploy an AI system, you must ensure it meets all the usual NHS data protection standards. For example, controlling who can access the data, encryption, and so on. The DSP Toolkit is essentially a checklist and self-assessment that says, yes, we are doing everything expected to keep data safe and private. Applied to AI, it ensures nothing is overlooked on the data privacy front. In practice, this might mean doing a data protection impact assessment for your AI project and confirming in the toolkit that all risks are mitigated. MHRA Guidance for AI as a medical device. The MHRA, the Medicines and Healthcare Products Regulatory Agency, is the UK body that regulates medical devices like insulin pumps or MRI machines. Some AI software in healthcare can qualify as a medical device, especially if it's used for diagnosis or to guide treatment decisions. For example, an AI system that analyzes medical images to detect cancer could be considered a diagnostic device. The MHRA has specific guidance on what you need to do with such AI. It might need to go through a certification or approval process similar to any medical device. This includes proving its safety and performance in clinical trials or evaluations. If your AI tool falls under that category, you must follow MHRA rules, register it, report any adverse incidents, and so on. The upshot: AI can be subject to the same strict regulations as a physical medical device, ensuring patient safety. ICO Guidance on Data Protection. For AI, the ICO is the Information Commissioner's Office, basically the UK regulator for data protection. They have issued guidance on AI and data protection, which interprets laws like GDPR in the context of AI. This guidance covers things such as ensuring transparency to patients about how their data is used in AI, fairness in algorithmic decisions, and conducting DPIs, data protection impact assessments, for AI projects. For example, if you develop an AI model using patient data, the ICO would expect you to have a legal basis for that, like patient consent or an official research exemption. You should also minimize the data you use, and possibly explain to patients if AI is involved in their care decisions. Together, these 4 items form a baseline for governance in the NHS. They might sound bureaucratic, but they're fundamentally about safety, ethics, and accountability. The assurance framework is about following best practices specific to AI. The DSP toolkit and ICO guidance are about protecting data and privacy. The MHRA guidance is about clinical safety and effectiveness as a regulated device. I'd say, if you're working on an AI in an NHS setting, your first step is to make sure you're aligned with all of these. They ensure you're not missing any big-ticket governance items. Has anyone here used or seen the NHS AI Assurance Framework in action yet? Perhaps you've been involved in an AI project that had to go through an assurance process? Great, so you know it provides a thorough checklist. Not yet. That's all right. It's fairly new, and likely to become more common going forward. The key point is, the NHS is not a wild west for AI. There are established frameworks to guide us. These frameworks are our starting point when we talk about AI governance in healthcare. Now, beyond these formal frameworks, let's talk about the fundamental principles that should guide any AI governance effort. In other words, what core values or pillars underpin everything we do in AI governance? That's up next. This slide lists 4 principles of AI governance: safety and effectiveness, transparency and explainability, accountability and oversight, ethical and equitable use. These principles are like the North Star for anyone governing AI. They might sound high-level, but they translate into very concrete practices. Let's break each one down and look at examples in a healthcare setting. Safety and effectiveness. First and foremost, any AI used in patient care must be safe. It should not harm patients. And it must be effective. It should actually do what it's intended to do, ideally better than or at least equivalent to current practice. For example, if we deploy an AI that predicts patient deterioration, safety means the AI's predictions shouldn't lead to dangerous interventions or false reassurance that causes mistreatment. Effectiveness means the AI truly identifies at-risk patients and helps clinicians act in time. We ensure safety and effectiveness through rigorous testing and validation before use, and by monitoring outcomes after deployment. This principle aligns closely with the traditional medical oath of do no harm. Even though it's an algorithm making decisions, the responsibility to avoid harm and actually help remains. Transparency and explainability. This principle is about making sure clinicians, and sometimes patients, can understand how the AI reaches its conclusions. We can't treat AI as a black box that just spits out answers with a trust me attitude. For instance, if an AI model flags a patient as high risk for sepsis, transparency means it can highlight the factors that led to that conclusion. Maybe the patient's blood pressure trend, white blood cell count, and temperature were significant contributors. Explainability is closely tied to trust. A doctor is more likely to trust and effectively use an AI recommendation if they can see the rationale behind it. It also helps in troubleshooting. If the AI is making mistakes, explainability lets us understand why. Practically, transparency might involve using simpler models when possible, providing explanations with each result. Some AI tools can produce these automatically using techniques like SHAP values, or offering clear documentation about the model's logic and limitations. In short, everyone impacted by the AI should understand, at least in broad terms, how it works and why it made a decision. Accountability and oversight. This principle ensures that humans remain responsible for AI-assisted decisions, and that there is clear oversight over the AI's operation. In a hospital, this means defining who is accountable if something goes wrong, and who monitors the AI's performance over time. For example, if an AI tool is deployed in radiology, the radiology department's clinical director might be accountable for outcomes, and a governance committee might review error rates or incidents monthly. We never want AI making decisions in a vacuum. Accountability also includes compliance. Someone has to ensure the AI is meeting regulations, perhaps an AI governance lead or compliance officer. The bottom line, clear roles and processes must exist, so that the AI is supervised just like any staff member. If an AI misdiagnoses a patient, we should already know who will investigate it and how to prevent it next time. Ethical and equitable use. This principle is broad but crucial. It's about using AI in line with ethical norms and ensuring fairness. Ethical use includes respecting patient rights, like consent for data use, and equity, making sure AI doesn't inadvertently discriminate or worsen health inequalities. For example, if an AI scheduling system prioritizes patients for surgery, an ethical, equitable approach ensures it doesn't systematically disadvantage a certain demographic group. In practice, this could involve bias testing, checking that the model performs equally well across genders, ethnic groups, etc. It might also involve ethics review during AI project approval and transparency with patients, for example, informing them if AI is involved in their care. Another angle is human-centric use. AI should support clinicians, not replace or undermine them. Equitable use also means distributing AI benefits broadly, not just to tech-savvy centers or specific patient groups. Now, these 4 principles, safety, transparency, accountability, ethics, aren't just buzzwords. They are the yardstick by which we measure governance practices. For instance, when implementing the AI Assurance Framework or the DSP Toolkit, the reason we do it is to uphold these principles. If you ever wonder, should we take this extra governance step, or is it overkill? Think back to these principles. Will skipping it compromise safety, transparency, accountability, ethics? A quick example. Earlier we mentioned transparency might mean clinicians understand an AI's decision. That is directly supported by governance steps like documentation and training. The slide highlights one example. Transparency means clinicians can understand how a model reached its decision. That could involve explainable AI techniques, or simply educating clinicians on the model's workings. Optional engagement. These principles might sound familiar because they echo fundamental principles of medicine and good data practice. If time allows, I might ask, do these principles cover everything, or is there another principle you'd add? People sometimes mention trust explicitly, or legal compliance, which generally fits under accountability or ethics. Usually, though, these 4 capture the main concerns. Now that we know our guiding principles, the question becomes, how do we actually put them into practice, especially in line with NHS requirements? The next slide shows how to align our actions with NHS assurance processes, essentially operationalizing safety, transparency, accountability, and ethics. Let's move on to how to do that. This slide is about aligning with NHS assurance. We've covered the principles and the frameworks. Now let's focus on 4 concrete actions that help align any AI project with NHS assurance expectations. Risk assessment and mitigation. Clinical safety standards, including DCB 0129 and DCB 0160. Information governance compliance. Ongoing monitoring and audit. Think of these as practical checkpoints to meet throughout an AI project's lifecycle. Conduct risk assessments early and plan mitigation. Every AI project should start with a thorough risk assessment. This means identifying what could go wrong and deciding how to prevent or reduce those risks. For example, if an AI supports diagnosis, one risk might be missing a condition in certain cases. Another could be generating too many false positives, which might overwhelm clinicians. Once risks are identified, mitigation strategies must be defined. This might include double-checking negative results, calibrating alert thresholds, or ensuring specialist review. Within NHS governance, this work is often formalized through clinical risk management processes under standards such as DCB 0129 and DCB 0160. The key message: do not wait until after deployment, address risks up front. Apply clinical safety standards, DCB 0129 and DCB 0160. These NHS standards govern clinical risk management for health IT systems. DCB 0129 applies to developers, while DCB 0160 applies to organizations deploying systems in clinical settings. In practice, this means involving a clinical safety officer and producing a documented safety case. All hazards are identified, and each one has a defined control or mitigation. For example, an AI misclassifying a critical condition might be mitigated by using it only as a second reader, not as a replacement for clinical judgment. Following these standards formalizes risk management and is often mandatory before a system can go live. AI should be treated like any other clinical system or medical device. Ensure information governance compliance. This includes data protection, confidentiality, and patient privacy. Aligning with NHS assurance means completing a Data Protection Impact Assessment, DPIA, confirming a lawful basis for data use, and ensuring data is secure and proportionate. You may also need to check supplier assurances, such as GDPR compliance or Cyber Essential certification. Some organizations involve ethics or AI review panels at this stage. From an assurance perspective, you should be able to clearly show your DPIA, DSP Toolkit compliance, and how patients are informed about AI use. Plan ongoing monitoring and audit. Governance does not end at deployment. NHS Assurance expects continuous monitoring of AI performance. This might include formal reviews at 3 and 6 months, tracking metrics such as accuracy, false alerts, and any safety incidents. Oversight groups should review this information regularly. This helps detect issues like model drift or unintended consequences. Any updates or retraining of the AI should be documented and reassessed for risk. Governance should be treated as a life cycle, not a one-off task. To summarize this slide, aligning with NHS assurance follows a plan, do, check, act cycle. Plan, identify risks and meet standards. Do, implement controls. Check, monitor and audit. Act, improve the system over time. This approach turns governance into an ongoing commitment, exactly what the NHS and patients expect. Now that we've covered standards and assurance, let's move to the next slide. We'll look at practical steps you can take in your organization to establish robust AI governance. Here are 6 practical steps for implementing AI governance in an organization. Develop an AI governance policy. Create a record of AI assets, AI asset register. Define roles and responsibilities. Establish oversight committees. Integrate risk management processes. Continuous monitoring and reporting. This is where theory meets practice. These steps embed principles, frameworks, and assurance into everyday operations. Let's look at each briefly. Develop an AI governance policy. Start by formally documenting your organization's approach to AI governance. The policy should define scope, which AI systems it applies to, core principles, safety, transparency, fairness, specific requirements, mandatory reviews, NHS compliance, staff training. This becomes the internal rulebook for developing or deploying AI. A clear policy ensures consistency, sets expectations for teams, and reassures leadership that AI is being managed responsibly. For example, it might require a named clinical lead and data protection approval before deployment. Board-level approval signals leadership support. In short, if someone asks, how do we handle AI here? This policy provides the answer. Create a record of AI assets, AI asset register. In large organizations, AI tools can appear through vendors or pilots without full visibility. An AI asset register is an inventory of all AI systems in use or development. Each entry might include purpose, owner, vendor, implementation date, and governance status. Some organizations use model cards to summarize intended use, performance, and limitations. Maintaining this register provides visibility, supports regulatory responses, avoids duplication, and helps prevent shadow AI. It's about documentation and awareness. Know what AI you have. Define roles and responsibilities. Governance fails when responsibility is unclear. Define who is accountable for each aspect of AI. Typical roles include executive sponsor, clinical lead, technical or data science lead, information governance and security leads, chair for AI governance oversight. Clear ownership ensures issues are escalated appropriately and decisions are made at the right level. For example, who approves deployment, updates, or retraining. Responsibilities should be defined up front in policies or project documentation. Establish oversight committees. Consider an AI oversight committee, or extend an existing digital or clinical governance group to cover AI. Membership should be multidisciplinary, clinicians, IT/data experts, governance or risk officers, and potentially patient representatives. The committee provides structured oversight, approving proposals, reviewing performance and incidents, and ensuring actions are followed up. Smaller organizations may not need a new committee, but regular, formal oversight is essential. This creates accountability and shared expertise. Integrate risk management processes. AI risks should be embedded into existing organizational risk management, not treated separately. Ensure AI-related risks are logged on clinical or corporate risk registers, with owners, mitigations, and review processes. Use established systems for incident reporting and change control, so AI issues follow the same escalation routes as other risks. This ensures AI risks are visible to senior leadership and regulators, and are managed consistently with financial or operational risks. Continuous monitoring and reporting. Set up ongoing monitoring of AI performance once systems are deployed. This might include dashboards tracking accuracy, usage, alerts, or outcomes. These should be reviewed regularly by managers or oversight committees. Monitoring should trigger action if performance degrades. Reporting also supports transparency, internally to staff and leadership, and potentially externally through public reports. Continuous monitoring reinforces trust and accountability. Together, these 6 steps provide a strong foundation for AI governance. Some are straightforward, while others, like sustaining monitoring or establishing oversight, can be challenging and resource-intensive. Different organizations will struggle with different steps, which is why anticipating these challenges matters. Many of these steps require culture change and engagement. Framing governance as enabling safe innovation, not bureaucracy, can help secure buy-in. A recurring theme here is trust. Trust in AI systems and trust that governance is effective. Ultimately, these processes aim to build accountability and confidence. In the next section, we'll focus explicitly on building trust and accountability when deploying AI. The title here is Building Trust and Accountability. This slide highlights 4 key strategies: transparency in decision-making, stakeholder engagement, public communication and education, audit trails and documentation. Together, These help people trust AI systems and ensure accountability for decisions. Transparency in decision-making. Trust grows when people understand how AI reaches its conclusions. For clinicians, this may involve explainability features that show key factors behind recommendations. For example, blood sugar levels, blood pressure trends, and age may have influenced an output. Where this is not technically possible, organizations should provide clear documentation explaining the model's logic, priorities, and limitations. Transparency also applies to governance processes, including how the AI was tested, validated, approved, and monitored. Being honest about what the AI cannot do is just as important as explaining what it can do. This helps users feel in control, spot anomalies, and use AI appropriately. In practice, this may involve selecting explainable tools or providing clear user guidance. Stakeholder engagement. Stakeholder engagement means involving the right people throughout the AI lifecycle. This includes clinicians, patients, data scientists, IT teams, managers, and governance leads. Early engagement builds trust by avoiding the sense that AI is being imposed without consultation. For example, when introducing an AI triage tool in primary care, engagement might involve GPs, nurses, and patient representatives before deployment. Clinicians may highlight workflow issues, while patients may express preferences around disclosure or consent. Addressing these concerns early improves implementation and builds confidence. Engagement should also continue after deployment, through user groups or feedback sessions. People are more likely to trust and adopt systems they feel they helped shape. Public communication and education. Trust also depends on how AI use is communicated to patients and the wider public. Poor communication can lead to fear or misunderstanding, particularly in healthcare. Clear, plain language explanations help demystify AI. For instance, a hospital might explain that an AI tool supports clinicians by pre-screening images. It does not replace clinical judgment, has been tested thoroughly, and uses data securely. Communication can take many forms, including patient leaflets, websites, public talks, or annual reports. Being proactive and transparent helps shape an accurate narrative. It is far better for the public story to be that AI was introduced safely and openly, rather than unexpectedly or without explanation. Audit trails and documentation. Accountability relies on robust record-keeping. Audit trails should log AI recommendations, how they were used, and when they influenced care. For example, if an AI recommends discharge, and this is followed, the system should record the recommendation, time, and basis. If outcomes are later questioned, these logs allow investigation. Documentation should also cover governance processes, including validation results, oversight decisions, model updates, and version control. This supports learning, accountability, and regulatory review. Some organizations integrate AI outputs directly into patient records, clearly marked as AI generated. As with clinical notes, good documentation ensures decisions can be understood and justified later. Example: NHS Trust dashboards. Some NHS trusts use internal dashboards to share AI performance metrics. These might show patient volumes, accuracy rates, trends over time, and incidents reviewed. Sharing both successes and issues demonstrates openness and due diligence. This reassures staff that AI is being monitored and that problems will be addressed, not hidden. Transparency of this kind can significantly increase trust. Bringing it together, building trust and accountability is as much about culture and communication as it is about technology. Even the most advanced algorithms will fail to deliver value if people do not trust them or believe governance is weak. Transparency, engagement, public education, and strong documentation create an environment where AI is approached with confidence rather than suspicion. Have you seen examples where transparency or engagement improved trust in a new technology? Next, we'll ground these ideas in a real NHS case example, showing how governance supported a successful AI pilot in radiology and brought these principles to life. Let's examine an NHS Trust's pilot of an AI system in radiology. The team faced heavy workloads and used AI to prioritize X-ray images for review. Key governance steps included risk assessment, clinical validation, and patient consent. At a large NHS trust, the radiology department was facing mounting pressure from a growing volume of chest X-rays. To improve efficiency and support patient care, the trust piloted an AI-driven tool designed to help identify potential abnormalities in X-ray images. Before the tool was implemented, the project team carried out a comprehensive risk assessment. They identified several key risks. For example, the AI might miss subtle findings, known as false negatives, or it might incorrectly flag normal images, known as false positives. To mitigate these risks, a number of controls were put in place. All X-rays that the AI classified as negative were still double-read by a radiologist. Any images flagged by the AI were reviewed by a clinician before results were communicated to patients. The team also developed contingency plans for system downtime, ensuring there was always a seamless fallback to manual processes. Importantly, the trust did not rely solely on vendor assurances. Instead, the AI tool was validated in-house using historical X-ray data. The team measured sensitivity and specificity and identified known limitations, such as reduced accuracy on post-operative images. Clear operational boundaries were then defined for how and when the tool could be used. This validation process produced documented evidence of both the AI's effectiveness and its limitations. During the pilot phase, patients were informed about the role of AI in their care and asked for consent. This approach promoted transparency, respected patient autonomy, and reduced the risk of future complaints relating to the use of AI in clinical decision-making. Ethical approval was obtained where required. The pilot demonstrated clear, measurable improvements. Diagnostic turnaround times improved. For example, average reporting time for A and E X-rays reduced from 6 hours to 4. There were no data breaches or ethical violations. All governance documentation, including risk logs, validation reports, and consent records, were maintained and readily available for audit. As a result, the project passed both internal and external audits, meeting regulatory requirements, including those of the MHRA and the Information Commissioner's Office. Lessons for auditors. First, governance enabled innovation. Rather than slowing the project down, strong governance and risk management built trust and confidence among staff, patients, and senior leaders. Second, assurance was ongoing. Continuous monitoring and thorough documentation ensured compliance and created a clear, defensible audit trail. Third, scalability was achievable. Because the pilot was audit-ready from the outset, the trust was able to consider wider deployment, using the established governance framework as a reusable template. Key takeaway. In conclusion, effective governance and internal controls did not hinder innovation. They enabled the safe, compliant, and auditable adoption of AI in clinical practice. While we have seen a successful example in radiology, it's important to also address the difficulties and challenges in AI governance. Next, we'll discuss common challenges and lessons learned from implementing AI projects in healthcare. Even with strong plans and good examples, implementing AI governance brings real challenges. This slide highlights 4 common ones: data quality and bias, integration with legacy systems, skills and training gaps, and continuous assurance. These are pain points many organizations face. Data quality and bias. AI relies on data, and poor quality data leads to poor outcomes. In healthcare, data may be incomplete, inconsistent, or spread across multiple systems. Some information, such as social or demographic factors, may be recorded unevenly or not at all. Bias is closely linked. If training data reflects historical imbalances, the AI may perform worse for certain groups. For example, models trained predominantly on one ethnic group or skin tone may be less accurate for others. AI can also learn unintended proxies that reflect healthcare access rather than clinical need. Addressing this requires careful data curation, bias testing, and sometimes collecting new data. Teams must actively ask whether models perform equally well across populations and be transparent about limitations where bias cannot yet be fully resolved. Involving diverse clinical and domain experts helps identify issues early. Data work is often the most time-consuming part of AI projects, but without it, models are unreliable and unsafe. Integration with legacy systems. Healthcare IT environments often combine modern tools with aging systems. New AI solutions must integrate with electronic patient records, imaging systems, or monitoring devices that may lack modern interfaces. Technical incompatibilities, security constraints, and workflow misalignment are common obstacles. If AI outputs do not appear within existing clinical workflows, they may be ignored. Many promising AI tools fail, not because the model is weak, but because it does not fit how clinicians work. Successful projects involve IT and integration teams early, allow sufficient time and budget, and work with vendors to enable interoperability. Where integration is not immediately possible, organizations may start with a proof of concept while planning longer-term solutions. Integration challenges are rarely quick fixes and must be acknowledged up front. Skills and training gaps. AI governance requires both clinical and technical expertise, and few individuals have deep knowledge of both. Clinicians may not fully understand AI outputs, while data scientists may lack clinical context. Many organizations also lack in-house expertise in areas such as model validation, bias assessment, or AI ethics. Users need training to interpret AI outputs correctly and avoid misuse or over-reliance. Governance roles may also require upskilling, such as clinical safety officers or risk managers learning AI fundamentals. Common approaches include multidisciplinary teams, clinician data scientist partnerships, and targeted training programs. Investment in people is essential, whether through training, hiring, or external partnerships. The people element is often underestimated, but it is critical to success. And lastly, continuous assurance. AI governance does not end at deployment. Maintaining oversight over time is challenging as priorities shift, staff move on, and systems become part of routine operations. Models may degrade due to changes in data or clinical practice, a phenomenon known as model drift. Without ongoing monitoring and revalidation, issues may go unnoticed. Continuous assurance also requires staying aligned with evolving regulations and standards. Resourcing is a major challenge. Many AI projects are funded as one-offs, with limited provision for long-term maintenance. Successful organizations plan for this from the start, clearly assigning ownership after go-live and budgeting for monitoring, updates, and periodic reviews. Some schedule formal post-implementation reviews and link them to performance objectives. Taken together, these challenges can seem daunting. However, recognizing them early allows organizations to plan effectively. Which of these challenges resonates most with your organization? Data quality and bias? Legacy system integration? Skills and training gaps? Continuous assurance over time? Different organizations experience different pain points, though data quality and skills gaps are among the most common across NHS AI initiatives. Sharing experiences and lessons learned, including failures, helps the whole system improve. The key message is that these challenges are real, but not insurmountable. With planning, engagement, and realistic resourcing, organizations can overcome them and deliver safe, effective AI. We've covered principles, frameworks, practical steps, examples, and challenges. Let's now summarize the key takeaways on AI governance from today's session. To wrap up, I want to summarize the core messages from this session. If you remember nothing else, remember these points. Governance equals trust, safety, and accountability. AI governance is not about red tape. It's about ensuring trust, protecting patient safety, and maintaining clear accountability. A well-governed AI is one that clinicians and patients can trust, because they know it has been checked and is being monitored. Governance processes exist to prevent harm and assign responsibility, thereby upholding our duty of care. So when you think, why do we need governance? Think trust, safety, and accountability. These are the end goals. Align with NHS frameworks. Don't reinvent the wheel. Use the frameworks and standards already in place as your foundation. Align your AI projects with NHS guidance, such as the AI Assurance Framework. Follow the DSP Toolkit and other information governance requirements, and comply with MHRA guidance where relevant. These frameworks encapsulate collective experience and regulatory expectations. By aligning with them, you ensure you are meeting essential requirements for compliance and quality. They also provide external validation. If your project aligns with recognized NHS standards, it becomes much easier to gain buy-in from leadership and clinicians, because governance is not just your idea. It is an accepted benchmark. Implement practical steps. Principles and frameworks matter, but they must be translated into action. The 6 practical steps we discussed, policy, asset register, roles, committees, risk integration, and monitoring, are ways to embed governance into your organization. Have a clear policy to guide teams. Know what AI systems you have. Make accountability explicit. Provide oversight through committees. Integrate AI into risk management. And continue monitoring after go live. These are tangible actions you can start working on very quickly. Even implementing 1 or 2, such as creating an AI inventory or drafting a policy, is meaningful progress. These steps turn governance from an abstract concept into day-to-day practice. Engage stakeholders throughout. AI governance is a team effort. Engage clinicians, data scientists, patients, and leaders from the start and throughout the lifecycle. Keep communication open and involve stakeholders in decisions. This builds trust and improves outcomes because issues are identified early and buy-in is stronger. An engaged clinical champion can support adoption and training, while disengagement can undermine even the best tools. Engagement also means transparency. Be open about what you are doing, both internally and externally. Communicate clearly, educate users, and incorporate feedback. Governance should not happen in isolation. It should be part of everyday project conversations. If we distill this even further, it comes down to one message. Governance is not a barrier. It is an enabler for AI in healthcare. Done well, it allows innovation to happen with confidence. It turns unknown risks into manageable ones and helps AI deliver benefits rather than surprises. Governance is not a checkbox at the end or a hurdle to overcome. It is part of the journey, ensuring that when we reach the finish line, we do so safely. In many cases, governance actually improves the final product, as we saw in the case example, where validation and feedback strengthen the AI. Introducing AI without governance is like driving without seatbelts or insurance. You might move quickly at first, but it is not safe or sustainable. Governance is what allows us to move forward with confidence. So those are the key takeaways. Build trust and safety through governance. Use NHS standards. Take practical action. And involve people at every step. If you carry these principles back to your teams, you will be well equipped to start or strengthen AI governance in your organization. Thank you for your attention. We now have a few minutes for questions and discussion. Please feel free to ask anything about AI governance, whether it's clarification from today's presentation or a scenario from your own work. Common questions include gaining leadership buy-in and risk stratification for AI projects. Not all AI deployments require the same level of governance. More direct clinical impact means more stringent governance. If you have further questions or want to discuss specific cases, I'm happy to help. Now, let's move to the last slide for contact details. Here are contact details for further information or support. Tony Cobain, Digital Director, Andy Bodler, Principal Data Analyst, and Colin McFarlane, Head of Business Intelligence, Data Analytics and Systems, are available to discuss how MIAA can assist you with AI governance. If your organization is exploring AI, remember, the best place to start isn't with the technology, it's with the law, your risks, and your responsibilities. Thank you for being an engaged audience, and best of luck with your AI projects.